Welcome back to our feature story for you tonight. You know, it's an understatement to say that multiple sclerosis is a life-changing disease. It's also hard to understand, but some patients are getting a level of care that others are not. That's because their doctor is also a patient. Jen Lammers begins our look at this very unique story.
For the last 24 years, Sharon Shine has been living with multiple sclerosis. She comes here every month to get infusions of the drug Tysabri.
So it helps me be formed and not so loose and disorganized in my thought, my speech, and my gait.
MS is a degenerative disease that attacks the nerve signals from the brain. It can affect your mind, your body, or both. There is no cure. And for the MS patient, the challenges are tough to describe, especially for someone like Shine, whose symptoms aren't yet physical.
It was a strange experience, you know, because you can't really tell when it's going to happen. There's nothing that you do. It just comes over you. It just happens.
Lucky for her, she has someone who understands exactly what she's going through. That's because the same year that she was diagnosed with MS, so was her doctor, Vince Macaluso.
I specifically remember after being diagnosed, I went down to the basement of my parents' house, just sat there and watched TV, and just started thinking about things. And I said, I should be able to figure out how to cure this. And then after I became a neurologist, I said, no, you can't cure it.
Macaluso was 22 years old, a graduate of Cornell Medical School, and at that moment, facing an uncertain future. Without a known cure, he followed every development and every treatment there was.
My mother always told you can't treat yourself. You have to see your other doctors. And then after I made my discoveries, I realized the other doctors I was seeing didn't have the knowledge that I had. And then I said, well, I'm going to have to pull the trump card on that one, Mom. I started treating myself, and that's when I was able to finish my book.
In his book, Multiple Sclerosis from Both Sides of the Desk, Macaluso explores what it's like to be both patient and doctor. He says while MS has been a struggle in his personal life, as someone who treats others with the same disease,
it's been probably the greatest blessing I could have ever asked for. They come in and they start sitting down and talk about these nebulous feelings. Oh, my back is on fire all the time. Nobody understands what I'm talking about. I feel like my leg was just about to go out from underneath me. And I said, yeah, I had that yesterday.
Each of Macaluso's patients have different symptoms and different stories, but the disease is the same. And it's one Macaluso says he fights right along with them every day.
And once you have that sort of bond, then we both feel patient and doctor less alone.
He's made me feel comfortable and helped me to deal with this disease and have the disease not claim me, but I claim the disease. And that's good to have someone that you can talk to like that, and they can reassure you that it's going to be okay.
Gonna be okay. We like to hear those words. A lot of changes, Jen, since Sharon was diagnosed.
Yeah, definitely. When she was diagnosed back in '91, there were really no viable forms of treatment. Since then, there have been about 8 different iterations. And the one that she's taking right now it has proven to be by far the most effective.
Good.
At sort of keeping it together, if you ask the MS patient, and, you know, control and maintain that control of their mind and their body. That's very important to the person.
Very important. Good to hear. We like stories like that. And guess what? Dr. Macaluso is here.
He is.
I've got his book, and I'm going to talk to him right now. You can say hi to him if you like.
Hi.
It's all in the family here, Dr. Macaluso. We like your book, Multiple Sclerosis from Both Sides of the Desk. You were diagnosed with MS when you were just 22 years old, went off to medical school. You've had an amazing life. I mean, as a patient and also as a doctor. Tell us about that.
Well, I feel I've been doubly blessed to have the facility to become a physician, but then on top of that, to get a disease that hasn't taken away my ability to be a good doctor, but has actually made it better.
Not at all. You use the word a blessing, and I read parts of your book, and you do feel like it's a blessing because you're able to help people in a very special way.
Yes. By having the disease, it's so much of the disease you can't see. People think about people in wheelchairs, limps, trouble speaking like this, but the biggest trouble is how it affects our minds. We lose our abilities in initiative, concentration, emotional control, sexual functioning, urinary control, and behavior.
But it's treated. It's treated in many different ways, as we just saw. And you also have a good attitude. You're able to have this bond between your patient. You can understand whatever they're going through. You can explain it to them because you've been through it as well.
Yes.
It's a great relationship.
It is. And I have patients coming in saying, you're going to think I'm crazy, but it felt like my back was burning yesterday and there was this hug around me. And I said, no, I had that yesterday. And so they feel less alone.
You also mentioned in your book how you should not allow multiple sclerosis to ruin your family life. The family comes into play here.
Yes. By having changes in our personalities, some of people who we fall in love with, our spouses, some see it and they say, oh, it's a change, I'll put up with it. But others, they see it and they get scared because they don't know what's going on and they weren't ready to care for the person that they had fallen in love with, and they run. And divorce is common, but I hope that by teaching what's going on in our minds through the book, it'll help to educate those people so they'd be less scared and realize that they can still love the person they always loved.
I mean, you must know that you're an inspiration to a lot of people. People who are listening to you right now see the kind of person you are, what you've been able to achieve, and what they can do too. There are like 450,000 people with MS in this country. You can make a big difference, can't you?
I hope so, yes. Through the book, through getting around the country, talking with people, I've probably spoken about 5,000 MSers in the course of my career and doing talks around the country. And I hear great stories about how, like, their kids say they take care of mom. It's their job to do something to get her ready for work in the morning, so they feel empowered. And then the spouse and other caregivers fill in the roles that they can do and realize that we can function just fine. And if you just have the willingness to open up your ears and listen.
Absolutely.
Yeah.
You're doing wonderful work. I have to shake your hand.
Thank you.
Dr. Macaluso, thanks for being here today. Good luck with your book, Multiple Sclerosis from Both Sides of the Desk. And you keep it positive. We like that.
You too.
Thanks so much. All right. Coming up, putting up